Welcome to today's video. So today I want to talk to you guys about my experience going through an IVF pregnancy. In general, IVF pregnancies are considered higher risk than natural or non-IVF pregnancies. So I had to do additional monitoring and testing for my pregnancy. So I do want to go over all of that with you guys. When I was sitting down the other night preparing for this video, I was reading a bunch of research articles on why IVF pregnancies are higher risk, but I just ran out of time with my newborn and juggling all of that. I just don't have time to read the research behind why IVF pregnancies are higher risk, but just know they are. What I did come across, which was kind of interesting, is they're not as high risk as I thought. So for instance, the percentages aren't really that high. And specifically when it pertains to pregnancy-induced hypertension is what I had, and pre-eclampsia, I also had that and was hospitalized for a week. Those two risk factors, pregnancy-induced hypertension and pre-eclampsia, the percentages on that is like 3 to 5% of women that have non-IVF pregnancies get pre-eclampsia and hypertension, compared to, I think it was 10 to 13% of IVF pregnancies result in preeclampsia and hypertension. So when you compare those percentages, 3 to 5% in the non-IVF pregnancies versus 10 to 13% in IVF pregnancies, I feel like that's not a huge difference. It's statistically significant enough to where IVF pregnancies are considered like higher risk, but I thought the percentages would be much higher for IVF pregnancies. So I will mention some of the risks IVF pregnancies involve in a few minutes, but just know that they are considered higher risk than non-IVF pregnancies, but the percentages aren't really that much higher from what I saw in the research. And then of course, the older you are, especially if you're advanced maternal age like myself, so over 35 years old, your risks of complications do go up. I will link a few really interesting articles in the description box below if you guys want to read about like why IVF pregnancies are higher risk. The science behind it is pretty interesting. And also I'm finding out that they really don't know 100% for sure why IVF pregnancies are higher risk. It seems to have something to do with how the embryo is implanted into the uterus and like how the female gets pregnant in an IVF pregnancy versus a non-IVF pregnancy. But I'll let you guys read those articles down below. I just didn't have time to actually give you guys accurate information and to understand it better myself. So I definitely plan on researching it further because it's so fascinating to me. Okay, so that was kind of a long intro into the video, but I will go over my IVF pregnancy experience and the additional testing I had to go through because I was considered higher risk. And if you guys are brand new to my channel, welcome. I upload one video. Right now it's only been one video every Sunday morning, 8 a.m. Pacific Standard Time, all about living healthy and IVF and healthy living. So welcome if you are brand new, and welcome if you are a returning subscriber. Thank you so much for watching. And I hope this video kind of helps with your understanding about IVF pregnancies. And if you're about to go through an IVF pregnancy or you're in an IVF pregnancy, maybe this video will help you. Just as a reminder, I am no expert on IVF. I'm just wanting to tell you guys my experience going through an IVF pregnancy. You guys who have already been through IVF pregnancies, maybe you had a different experience and different testing, but I want to tell you guys what I had to do in terms of like testing and monitoring. The main risk factors that are a little bit higher in IVF pregnancies versus normal pregnancies are pre-eclampsia, pregnancy-induced hypertension, diabetes, and placenta previa. And there's a few more, but those are the four major ones. You guys who have been with me for the last few months know this already, but I was hospitalized for a week with pre-eclampsia, and because I had those conditions, they induced me at 37 weeks exactly. So my little man is now 6 weeks old, and I have him on the monitor here. So if you hear swishing sounds, it's the sound machine in my room, and I have the sound on in here so I can hear him if he wakes up. So I apologize if this is bothering you, but I have to monitor him while I talk to you guys. He should be waking up any minute, so cross your fingers I can get through this video with you guys before he wakes up. All right, so let me start from the very beginning. I want to take you guys through my whole pregnancy starting from the first trimester. So right from the get-go, finding out I was pregnant was not your typical way of finding out you're pregnant. Of course, I had a frozen embryo transfer on July 1st, this past July 1st. 10 days, actually it was 11 days later, on July 11th, I went in for an HCG blood draw, and that confirmed that I was pregnant. A few days later, they redrew my HCG level and it went even higher, so it confirmed that the pregnancy was developing. There was a few week waiting period, and then I went into my fertility clinic for my first ultrasound, which was an 8-week ultrasound. Everything looked good on that ultrasound, so I found an OB, and my OB provider did my 10-week ultrasound. I'm really not sure what other women going through IVF pregnancies are comfortable with, but I chose an OB provider that specialized in high-risk pregnancies because I just wasn't sure about being pregnant through IVF, what that involved. So he was already familiar with IVF pregnancies. He's well established in the area. He's been an OB doc for a long time, lots of experience with high-risk pregnancies, and is affiliated with my fertility clinic. So I chose him. Before I get any further into my experience going through an IVF pregnancy, I do want to emphasize that IVF is is completely safe. Like, I don't want to scare you guys who are like about to go through IVF or like scared of an IVF pregnancy that like something bad's gonna happen to you. IVF itself is completely safe. IVF pregnancies are safe. You just have to be monitored a little bit closer. Most women going through IVF and IVF pregnancies do fantastic, and babies are healthy and all that stuff. So I just don't want to like scare you guys. Plus, remember, I'm not an expert. I'm just telling you my experience and what I've read. So after my 10-week ultrasound, I had my 20-week anatomy scan, and they didn't have to do any ultrasounds or really any additional testing between my 10-week and 20-week ultrasound. So that was really nice. After my 20-week ultrasound, I had a 24-week fetal echocardiogram. And what that is it's an ultrasound looking at the baby's heart specifically, and it takes about a half an hour, and it's actually just like the anatomy scan or the 20-week ultrasound, but it just looks at the heart. It was very cool for me seeing baby's heart on the monitor and like it pumping, and they could measure like the blood through each of the 4 chambers. They could measure like the baby's EKG and of course heart rate and all that stuff. So it was very interesting. And the reason for the fetal echocardiogram done at 24 weeks is because IVF babies, specifically babies that are formed from embryos done with a method called ICSI, I'll put it on the screen here, are at a little bit higher risk for congenital heart defects. And by a little bit, I mean like 1%. So it's really not that much higher than regular babies formed like the natural way. But because of that 1%, like a little bit higher than other babies, then they do recommend that IVF babies formed with the ICSI method do these additional heart tests in utero. So of course, my baby was formed from an embryo made from the ICSI method, which is when the embryologist uses a needle to inject the sperm into the egg, versus I think the other method is just like having the egg and the sperm like just come together. But I think most, is what I've been told, is most embryos now are formed with the ICSI method. And for some reason, research does show that if the embryo is formed from the ICSI method, then that baby has a little bit higher chance, like 1% chance of having a congenital heart defect, and little man's waking up. So let me go soothe him real quick. So that information I just told you I got from my maternal fetal medicine doctor. Of course, they specialize in all these things. But yeah, comment down below what you've heard about ICSI method and babies having congenital heart defects. All right, well, little man is gonna join us because he just wants to be held. And for those of you who are brand new, this is Quinn. He is now 6 weeks old and full of himself, but that's okay. He's gonna join us now for the rest of it. So while we're on the topic of congenital heart defects, the other thing I had to do for him was a fetal non-stress test starting at 36 weeks. And what that test involves is they just put like 2 bands around your belly, and they just monitor his heart, and they take like rhythm strips of his heart. So it's not an ultrasound, it's just that they monitor his heart rate for about a half an hour, and they look at the waveform of the heart or the EKG pattern. So I only got to do one of those with him because I was hospitalized right after my 36-week non-stress test, and then of course I got induced at 37 weeks. But they recommended for me that I do a non-stress test on him at 36 weeks, 37 weeks, 38 weeks, 39 weeks, and then 40 weeks if I go all the way to 40 weeks, but I didn't get that far. So backing up, after my 24-week fetal echocardiogram, they had me wait a little bit, and then they had me do a 31-week ultrasound. So then starting the 3rd trimester, I had a lot of ultrasounds. I had a 31-week ultrasound, and then a 34, 36, and then I would have a 38-week ultrasound, but of course I already had him. But they want to do an ultrasound on me every other week, basically all through the 3rd trimester, to make sure that the placenta looked good, fluid levels looked good, he looked fine, because I guess with the placenta problems that could happen, they just wanted to make sure everything looked good. I think every female has to do this on their 3rd trimester, but I had an OB appointment every single week, I think starting at 30 weeks. Yeah, so ultrasound every other week basically through the last half of the 3rd trimester, and an OB appointment every week. So it was like 2 appointments a week for me. Plus the fetal non-stress test happened at a different office. So I basically had 3 appointments every week the last few weeks of my 3rd trimester, and then I got hospitalized early. So yeah, the rest is history, right? So he looked fine, his heart looked fine. I looked good all the way up until I got induced, well, all the way up until I got hospitalized. My blood pressure was very high, and they diagnosed me with pregnancy-induced hypertension and mild pre-eclampsia. I did tell you guys all about my birth story, so I'll link that video down below if you're interested in like how I got hospitalized for high blood pressure, what happened, and like how I got induced and the whole 9 yards. I'm still a little traumatized from it, but yeah, I did record my whole birth story if you're interested. Before I conclude the video, I did want to mention before I forget that a lot of people have asked me if I got put on a baby aspirin, and the answer is no. And I don't know why, because I feel like I was at higher risk for developing pre-eclampsia. Of course I did develop it, but I think a lot of people get put on baby aspirin like even before they get pregnant or at the beginning of their pregnancy to prevent preeclampsia. So I don't know why that wasn't prescribed to me. I feel like that could have helped. Yeah, so that's basically it. It was just additional ultrasounds and then the fetal echocardiogram, the non-stress test basically was the gist of it. I did have additional OB appointments at the end, but I think a lot of people do anyways. And then me getting hospitalized for pre-eclampsia and hypertension. It's not uncommon, but it's not that common either, if that makes sense. So I don't want to scare any of you that it's going to happen to you. It's really doesn't happen that often. But I did want to make this video because I really was not aware at all that my risk for pre-eclampsia and hypertension is significantly up enough to where additional monitoring is needed throughout the pregnancy. And I just don't know why I had no idea. So I want to inform you guys. All right, I'm going to go feed little man again. By the way, I am going to make a breastfeeding journey video because honestly, the hardest part of postpartum recovery for me has been breastfeeding. It is so hard, you guys. For me, it's really, really hard. I think some women have an easier time, but I've had a really hard time breastfeeding and we're on week 6 and I'm finally kind of getting the hang of it. But yes, that video is gonna come sooner than later. All in all, it was all worth it. All of the scary moments in the hospital and then being induced and all that stuff, totally worth having him. Of course, going through IVF, totally worth it. Not a day goes by without me just crying happy tears, just staring at him and just still honestly like, sometimes I can't believe it, just staring at him like, oh my gosh, how do I have you? Like, it's been, gosh, like I tell you guys I've had infertility for over 10 years, but it's been longer than that. And I just kind of in my mind wrote it off that I would never be a mom. It's fine. I got a puppy, which is now 1.5 years and he's a terrorist still. I'll just, have animals. I won't be a mom, but that's fine. Like, I'll just be a fur baby mom. Yeah, so I cannot emphasize enough that it is worth it. That's for sure. All the pain and suffering and money you have to go through with IVF, totally worth it. Okay, on that note, give this video a thumbs up if you liked it because it does really help support my channel. I will see you in the next one and always remember to be kind to yourself. Say bye, YouTube. Oh, there it goes again.